traditional technique for male breast reduction surgery, also known as a reduction mammoplasty, uses an incision around the areola to open the skin and remove the underlying breast gland tissue. This procedure is designed to remove mostly breast gland tissue and a little amount of fat. It is not a complex procedure and is considered generally safe, but requires you to avoid exercise and physical strain for 2 weeks following the surgery in order to minimize the risk of developing bleeding in the surgical site and to allow for the skin to heal properly. Our surgeons use a minimal scarring technique for male breast reduction surgery that leaves an inconspicuous scar, unlike the traditional techniques that require an incision around the nipple. This technique greatly improves on the traditional surgery by offering smaller and hidden scars, a faster recovery, lower risk of bleeding following the surgery, and a better cosmetic appearance. In the operating room, firstly, your skin will be cleaned with a disinfectant solution and you'll receive an injection of local anesthetic, after which a few small incisions will be made in the skin. The anesthetic solution is to ensure that the area is completely numb before proceeding with the actual procedure. You'll be asked to change position from time to time to give the surgeon better access to the fat deposits. You may also be asked to stand several times so the progress of the procedure can be assessed. When the procedure is over, absorbent pads and a pressure garment will be applied and you'll be taken to the recovery room. Once you have recovered from your surgery, you'll be able to go home once the effects of the sedation have worn off. Most patients leave after about 30 minutes to 1 hour to spend the rest of their recovery at home. You'll be given detailed, post-operative written instructions, and a follow-up appointment will be arranged for you in 6 weeks. You'll be given all necessary painkillers and antibiotics to take after your procedure. You can expect your recovery to be rapid, but there will be some swelling and bruising of the treated area with some associated numbness. This is temporary. You can help reduce these side effects by wearing a firm support garment for at least 3 days or until the fluid drainage stops. The worst of the swelling will subside in the first few weeks. However, it may be as much as 2 months before the full effect of the male breast reduction surgery is apparent. As with all surgeries, there are some risks involved. These risks include bleeding, infection, swelling, and blood clots, but these are all rare. Our operating suite is state-of-the-art, and we do everything we can to minimize the risks associated with surgery. Most importantly, your surgeon has comprehensive protocols in place to prevent complications from occurring.